Don't panic. When you get home, I know you're going to look at your ultrasound results, and I want you to know there's something wrong with the baby. It looks like your baby only has one kidney. Wow, that's not what my husband and I had planned on hearing when our physician called with the results of my 20-week ultrasound. Your baby only has one kidney? Immediately, all these questions came to my mind. What did the doctor mean when she said there was only one kidney? What caused it? How can we fix it? Will it impact my baby's future? Throughout my pregnancy and the first 2 years of my son's life, I have been trying to find the answers, and I'd like to share those with you. What diagnosis does my baby have? A person born with one kidney has unilateral renal agenesis, and a person born without any kidneys has bilateral renal agenesis. The March of Dimes statistics note that unilateral renal agenesis happens between 1 in 450 and 1 in 1,000 births, which is less than 1%. And bilateral renal agenesis happens in about 1 in 3,000 babies. Because the kidneys function to help remove waste products and filter the blood, a condition like renal agenesis can sound scary. Without a kidney, how would a baby handle all the work that normally is done with 2 kidneys? Most people born with a solitary kidney actually end up with a super kidney. The one good, fully functioning kidney will do all of the work that would be done by typically 2 kidneys, and this will have no risk or for complications down the road. Bilateral renal agenesis would require the use of dialysis machines in order to make the kidneys function properly. How did this happen to my baby? I was 35 when I was pregnant with my son. To doctors, I was termed advanced maternal age. Oh my gosh, did I do this to my baby? As a parent, all I wanted to do was everything that I could for my child, even before he was born. I had a pretty healthy diet, I exercised, and I avoided smoking and alcohol. As it turns out, there was nothing that I did wrong that caused this. It had nothing to do with my age, diet, exercise, or my social habits. The Indiana State Department of Health states the exact cause of renal agenesis is not known. It is thought to be multifactorial, meaning multiple factors, including genetics and the environment, are necessary for renal agenesis to occur. From a genetic standpoint, the website infokit.org notes that most renal agenesis cases are not genetically inherited, but rather they are caused by genetic mutations, and often part of other genetic syndromes, such as Down syndrome. With my mind at ease, knowing that there was nothing more that I could have done to prevent this, I focused in on how I could fix this and how it could be treated. Those with a solitary kidney usually require close follow-up with the physician just to make sure that their healthy kidney is progressing and there's usually no surgery needed. The outlook for those diagnosed with bilateral renal agenesis, unfortunately, is poor. The Congenital Disorders Sourcebook, 3rd edition, explains that if both kidneys are absent, the baby cannot produce urine, which is needed to form the amniotic fluid. If amniotic fluid is not present, the baby's lungs cannot grow and mature properly. Sadly, the majority of bilateral renal agenesis cases end in stillbirth or early death. As my now rambunctious 2-year-old runs around the house, singing and babbling, pushing his cars across the floor, hugging on his sister, I am grateful that he appears to be living a normal life and hitting all of his milestones on time. This does not mean that his future will be without any issues and that he will be able to do everything he wants to in life. Dr. I. David Weiner advises in the Encyclopedia of Kidney Diseases and Disorders that people with one kidney should be careful to avoid injury, and if they participate in contact sports, such as football or hockey, that they need to wear protective gear. Currently, my son is obsessed with watching football on television. The football will not be in his future. He will not have to sit out of sports entirely. He can continue to be as active as he wants, which will help him to maintain a healthy blood pressure and a healthy lifestyle, which will help him be prevented from having hypertension, which could lead to renal failure. Renal agenesis may seem scary at first when the diagnosis is sprung on you. Over time, I have learned that life does go on, and it doesn't have to change drastically because of it. People can go on to lead completely normal lives. I see this every day in my son. He is learning, he is growing, he is thriving, he is living with renal agenesis. Thank you.